Hello everyone, now we're going to do a very high yield topic, the thyroid gland, and we'll be covering all the various high yield points because literally 80% of this topic is extremely important in terms of MCQs and in terms of SCQs. So let us begin. Alright, and the rest of this video will be in both English and Urdu, meaning I'll be jumping from one language to the other. See? And that's just how I roll. Anyways, so let's start with the location. ठीक है जो thyroid gland है ना, it is obviously located over the trachea, right? But what or which vertebral levels does its location correspond to? So as a first high yield point, the location. Now let's talk about the capsule. Thyroid gland has two capsules, a false and a true capsule. And the true capsule is simply a condensation of the fibromuscular stroma, or the fibrous stroma of the thyroid gland, and that is my representation of the thyroid gland. The capsule of the thyroid gland, the true capsule. And outside of the true capsule, there is another fibrous capsule which happens to be called as a false capsule. Now, the important high yield point is that they ask you about the formation of this false capsule. It's basically one of the derivations of the pretracheal fascia, which is a layer of the deep cervical fascia. So that's a high yield point to be remembered. Third important point is the location of a plexus of the thyroid gland, and that is just deep to the true capsule. There is a plexus, and I'll be representing the plexus with these squiggly lines. So that is an important point, because when you're carrying out a thyroidectomy, you have to remove the thyroid gland along with the true capsule, such that this part is removed alongside it, because otherwise it would lead to a lot of bleeding. So another important point to be considered. Now, obviously, when we draw the thyroid gland, we tend to sort of like draw it kind of like this, because it has this lobe and it has this isthmus portion over here. And this isthmus portion basically lies on the second and third and the fourth tracheal rings. And then they ask you about the relations. And for that, for example, we can make a cross section at this level, and we'll get something that would be roughly like this. Actually, not quite like this, obviously, but quite similar to it. So the relations will then be, I ought to have made this a bit more like this. Now, the relations will include the anterolateral relations, the posteromedial relations, and the medial relations. Now, the medial relations are very obvious. We've already stated that the thyroid gland is somehow embracing the trachea. Now, the isthmus basically overlies the second, the third, and the fourth tracheal rings, right? So, obviously, over here we'll be representing the trachea, right? So, this over here is the trachea. But not just the trachea, the larynx too, obviously, because we know that this portion, which is the left lateral lobe, yes, the lateral lobe, it basically is lying over part of or overlying, is being a better word, it is overlying the thyroid lamina. Okay, now? So basically this over here is the trachea, but above that is the larynx, and that is also a medial relation, and behind it we have the pharynx, and then below it there is the esophagus. So over here I am representing the esophagus, but above this portion, part of the pharynx is also a medial relation, and to be more exact, just the inferior constrictor. The pharynx is made up of three constrictors: superior, middle, and then inferior. So the inferior constrictor part of the pharynx is a medial relation of the thyroid gland. Alrighty, so this is the esophagus. My apologies, this is the trachea and a part of the larynx above it. And this is the esophagus and the inferior constrictor above it. So I'm hoping this kind of makes sense. Now there's a muscle known as the cricothyroid muscle, and that is basically extending between the cricoid cartilage, a part of the larynx, and the thyroid cartilage, another part of the larynx, which is a little bit above it. So the cricothyroid muscle is an important medial relation. So now what about the lateral relations? For that, you need to be aware of the location of the infrathyroid muscles. So most of the infrathyroid muscles are rather related to it, and that includes the sternohyoid, the thyroid, and the sternothyroid, and even part of the sternocleidomastoid. So when we're showing that, we kind of make it like this, and then we make a part which is a bit overlapped, right? So, and then this. Okay, so I'm hoping this makes sense. So this muscle is, as I've already stated, one of the introhyoid muscles. This is the sternohyoid, right? And this one over here is the superior belly of the omohyoid, and this is the sternothyroid, sternohyoid, superior belly of the omohyoid, and the sternothyroid. And these are the anterolateral relations, and even a part of the sternocleidomastoid forms a part of it. So this is my representation of the sternocleidomastoid. Now, posterior to the lobe is the location of the carotid sheath. Now, the carotid sheath is also one of the derivations of the deep cervical fascia, and the carotid sheath happens to contain this artery, the internal carotid artery, more laterally the internal jugular vein, and a bit posterior and lateral to this we have the vagus nerve, and this looks kind of cute. So this is the carotid sheath, and that is an important posterior relations, and we're done with the relations that we can understand in this particular scheme. Now let's move over here. So when we talk about this one over here is an apex, and this is the base. So this is my representation of the vagus, and it's not that accurate, but so the vagus has a nerve, and when you're going to do the branches of the vagus, you'll understand this a bit more, and that is known as the superior laryngeal nerve, right? And so this is the superior laryngeal nerve, and the superior laryngeal nerve, it basically is heading towards this apex, and along the way it's going to divide. It's going to give a branch, the internal laryngeal, and the internal laryngeal nerve is going to go somewhere in this direction, and it's supposed to pierce a membrane known as the thyroid, which extends between the thyroid cartilage and the hide bone, and the hide bone is at the C3 level of the cervical vertebrae. Now the other branch is the external, and the other branch is the external laryngeal nerve, which is a relation of the apex. So they ask you oftentimes, especially in the vivas, what are the relations of the apex of the thyroid gland, and you're supposed to say the external laryngeal nerve and not the internal, and this can be a confusion. So you must remember that the internal laryngeal nerve is the one that's going to go inside. It's going to pierce the thyroid membrane and reach the deeper structures, whereas the external will reach the apex. Now similarly, we have the external carotid artery nearby, and it's going to have a branch which is the, and the name is, I can't quite remember the name. So this particular branch is going to travel towards the apex alongside the superior laryngeal nerve, right? And it's going to also be one of the important relations that must be considered. And I remember now, it was the superior thyroid artery, and that's so simple. That was very silly of me because it is related to the superior part of the thyroid gland, so it is the superior thyroid artery. And it's going to course really, really close to the external laryngeal nerve, initially the superior laryngeal and then the external, but right near the apex there will be a bit of a bifurcation, right? There's going to be a bit of a bifurcation. So actually, nearer to the apex, the two are both related to the apex, but they have the maximum distance in between. The one thing over here is that I simplified this representation in order to show the relation. The thing is that after having reached the apex, it turns somewhat medially. It turns somehow medially, right? So when we talk about the medial relations, we must also talk about the external laryngeal nerve and another nerve, which we will be talking about in just a while. I'll introduce it in just a bit. So what about the apex? Now the vagus has another nerve which interestingly turns down and then upwards, and that is known as the recurrent laryngeal nerve. And the recurrent laryngeal nerve is one of the relations of the base. And similarly, there is a branch known as the inferior thyroid artery, which is kind of goes like this, right? And that is also a relation of the base. Now the interesting thing is that the recurrent laryngeal nerve, which is a branch of the vagus, after getting its relation or becoming related to the base, it turns medially, and becomes a medial relation of the thyroid gland. So these are all important things that you must never forget. As far as the borders are concerned, we have this part which is anterior, and then we have the posterior bit over here, right? So this is important. And then we have the medial bits. Now if they ask you what are the relations of the posterior border, you have to realize that there are certain glands, the superior and the inferior parathyroid glands, and they tend to always be located at or near the posterior border. And interestingly, the inferior thyroid artery, which we talked about in terms of the relations of the base, and then in terms of the relations over here, my apologies, we did not speak of it in terms of the relations over here. The second relation is with the posterior border. And the reason for that is because there will be an anastomosis. This is the medial border, this is the anterior border, and this is the posterior border, right? The posterior border will be related to the superior and the inferior parathyroid glands. It will also be related to the anastomosis between the inferior thyroid artery and the superior thyroid artery. The thing to understand is that we've already mentioned the superior thyroid artery as being a branch of the external carotid artery, which basically came down alongside the internal laryngeal nerve, and they basically then kind of like went their separate ways because this turned a bit medially and was then a relation of the medial part, a medial surface. The superior laryngeal nerve, it continues downward alongside the anterior border of the lobe, right? It kind of like continued like this along the anterior border of the lobe and then along the upper border of the isthmus, and it kind of like anastomosed with the artery of the opposite side. But one thing to understand is that this is not the main branch. This is just simply the anterior branch of the superior thyroid artery. There is also a posterior descending branch which basically courses behind alongside the posterior border. Similarly, when the inferior thyroid artery sort of like approaches the base, it gives off an ascending branch which goes upwards and kind of like anastomoses with the posterior branch of the superior thyroid artery alongside the posterior border.